Parkinson disease, it's one of the most known degenerative diseases of the brain, where we have a loss of a neurotransmitter called dopamine. In the early stages of the disease, we replace this dopamine by some medications. But at the progression of the later stages of disease, there will be no response of those medications. So we go for surgeries. There are two types of surgeries. Either we implant a battery, we call it a brain battery. Surgery is called deep brain stimulation, or an ablative radiofrequency surgery. Based on the progression of the disease and the patient exam, we can choose which type of surgeries that suits the patient. The main symptoms of this disease: tremor in the hands and the limbs, and rigidity where the patient cannot move his limbs freely, and bradykinesia, it's the slowness of the patient movement. We can see in the video a 45 years old gentleman with a disabling disease, a progressive disease where he cannot move his limbs and in a tremor 24/7. And we implanted the deep brain stimulation, and we can see he can walk again, he's back to work, he's back to normal life. And the other type of surgery, which we call it an ablative radiofrequency surgery, where we can target some of the basal ganglion nuclei by jamming those nuclei, and the patient, as you can see, it's a real-time effect and result by stopping the tremor and rigidity immediately inside the operating room.